and Catherine and I are joined by Martin, who covers the middle of Cornwall, and Lee, who's our data officer. We're currently without a project manager or a program manager. That advert, I'm giving people a heads up, in a couple of months I think it will be coming out, so we're looking for interested people that are wanted to come and lead and manage our rabble. No, our small and mighty team, that's what I should be saying. Manda, do you want to say a quick hello and then I'll start the slides?
Yeah, hi, I'm Manda, and I've been working with Annette and all of this for a number of years and set up and managed that team, and they are a brilliant small and mighty team. I handed it over to Tanya last year, so it would be lovely to welcome more people, and they will have an amazing time managing this exceptional small and mighty team. Back to you, Annette.
Thank you. So bear with me. I have got some slides, but I was listening to the introduction, or rather the people commenting today. Sorry, multitasking's not my strength. Okay.
Looks good, Annette. It's all appearing. Brilliant.
Can you see it now? Yes, all good?
That's great. All good.
Great. Okay, so what I was going to say before I start the slides, I think we may end up veering off piste, which is absolutely fine. These slides were prepared a while ago. Obviously, depending on who's here today, we can have conversations. I think I'll introduce and say we'll follow through some slides. I've got a few and then I'll pass to Manda. But I think then maybe we'll have a little bit more time at the end for questions and discussion. So Phil, looking at who's in the room, obviously this is recorded, so other people will be viewing, but there may be some other conversations that arise. I feel like some of these slides I can skip through quite quickly. Yeah, so the topic for today is why climate resilience matters for neighbourhood health. So the focus is on neighbourhood health. Stating the obvious, we are experiencing a climate and environmental crisis. Today, I'm going to take you back to basics. I'm going to take you back to school for the first bit, just really briefly skip over what climate change is, and looking at what climate resilience is, and then linking it back to neighbourhood health, and linking it to voluntary sector organisations. So please do butt in. I can't see anybody when I'm doing this presenting, so please do butt in, and I'll answer questions as I can. So what's climate change? So we are experiencing long-term changes in the Earth's average temperatures and our weather conditions. Again, going back to school, and I did used to be a geography teacher, it was a long time ago now, so bear with me if I'm insulting people's intelligence. But when I was teaching, it was kind of a new thing long time ago, and climate change and understanding the greenhouse gas effect was quite new. But now we're all accepting that burning fossil fuels, so coal, oil, gas, releases carbon dioxide. Deforestation also reduces the availability of trees to absorb that CO2. There are other greenhouse gases, so we talk a lot about carbon and carbon dioxide, but there are other important greenhouse gases. So don't forget methane and nitrous oxide. They're all released into the atmosphere. They all create a layer, a big blanket that traps in heat into our atmosphere, and overall that's what's increasing our temperatures. We've also contributed to environmental degradation through land use changes. So deforestation contributes to greenhouse gases being released, and the increase in urbanisation around the world reduces the amount, the ability that we can absorb CO2. The planet then is warming up. And we've also had changes in agriculture, food production and industry, all leading to more greenhouse gases being produced and our natural ecosystems being affected. Habitat loss is a massive problem across the whole planet. The UK used to be covered in a lot of forests, which obviously most of them have disappeared. So what is climate resilience? That's our ability as communities to withstand, recover from and adapt to the impacts of climate change. So we'll come back and talk a little bit more about resilience as we go through. So this is a voluntary sector forum presentation, so it's worth noting that the VCSE are working in communities and seeing firsthand the impacts of the environmental crises. What those voluntary sector organisations are doing is already supporting people, already naturally building climate resilience, but sometimes it's almost subconscious. So what we like to do is empower people to recognise what they're doing as being very positive, and building on those starting points, and build the ability for us all to adapt and respond to the changes in our climate and environment. So this slide, the next slide looks at how that is impacting Cornwall. So thank you to Cornwall Council for this lovely slide. We have experienced a lot of this more recently. I'm not going to read them all out, but basically we are suffering things that didn't used to occur regularly in Cornwall. So we're having more storms, and they are stronger storms. Amanda will talk about Storm Goretti more later. We're experiencing higher temperatures and changing patterns. We don't have our distinct seasons so clearly anymore. We are, constantly, as the British, we're very good at talking about our weather, but we are constantly, it's very changeable. We obviously in Cornwall have a lot of coast, so the coastal erosion is going to be more of a problem, and flooding, localised flooding is going to be more of an issue. And the wildfires, I still have vivid memories of several years ago now, driving up the A30 and seeing my first ever wildfire in Cornwall, which was shocking. So these things are happening now, and we can all, I'm sure, think about examples and share anecdotes from things that are happening to us and our communities. This next slide is obviously selecting lots and lots of news headlines. I'm not going to read through them all. Amanda, please do jump in if you wanted to say anything specific about these, but it just is demonstrating how many different impacts. It's not all directly weather related, it's our environment as well, changes in the seas. We've got the year of the octopus, Goretti I've mentioned already, and I like to point out the phrase, this is our future. It was a while ago, oh, these are sort of outliers and these are unusual things that are happening. This is now becoming the norm, so it is about our ability to adapt and prepare for these things that we're talking about now, rather than, oh, that was a bit strange, oh, I hope that doesn't happen again. It's very much that we are needing to respond. Amanda, did you want to say any more?
I think you're saying it exactly as it is, Annette, that we're looking at increasing levels of uncertainty, and I think that's what we're talking about when we're in resilience, aren't we? Our ability to cope with that. So reducing the impact of our actions that might make it worse, and then figuring out how we respond if and when it does.
Great, thank you. So the next slide is linking it very much on our health and the inequalities. So the impacts of climate change have a disproportionate effect on the most vulnerable people in our communities. So you, I'm saying you as in voluntary sector organisations, will witness this and be involved in supporting people in these situations. So those people with poor housing will be more affected by the extremes in heat and cold. People with poor housing will be more affected by flooding and flood risk, for example, if they can't protect themselves against those and prepare. Also, people with existing health conditions are more affected by those extremes in temperatures. So I'm not going to read through the whole slide here. I think it's a really nice visual, colourful way to point out some of the way that climate change exacerbates ongoing situations. So we're seeing the extreme weather leads to more increasing spread of diseases around the world. We've got increasing air pollution, which obviously has direct health impacts, more people suffering from asthma, cardiovascular disease, and more people experiencing allergies. We have a longer growing season, so hay fever is more prevalent throughout different times of the year, rather than having distinct sort of months for hay fever, for example. We're seeing rising sea levels, and that has an impact on water quality as well. We could have a whole session, I'm sure, talking about water and food supply impacts, but briefly just recognising that it is leading to malnutrition. We are struggling with food, and this has an impact on cost of living, because there's rising demands and lack of food supplies in our direct effect, but also across the whole planet. So the severe weather itself, so those extreme weather events, Storm Goretti, and other floods and other extreme weather events have direct impacts, but also the ongoing impacts, secondary impacts, but also mental health and the fear and the loss has a direct effect on mental health as well as physical. Extreme heat, I'll talk a bit more about in a moment, and the environmental degradation. The wider picture is that people are being forced to migrate around the world, but indirectly as well, we can see this in our local economy as, for example, impacts on fish stocks in Cornwall are going to have a direct impact on the fishers in Cornwall. So it's very complicated, and sometimes it gets a little bit overwhelming when we think about all of the effects of climate change, which is why we need to recognise this, but we also need to recognise that we are part of the solution, and we are already doing lots of good stuff. Few more stats from the UK. So poor air pollution is responsible for, or attributable for, 38,000 deaths a year. We've got an increase in new vector-borne diseases in the UK. Between 2020 and 24 in England, there are a total of 10,781 heat-associated deaths, direct consequence of heat waves. So that was over 4 years, and they're projecting that those heat-related deaths are going to rise to around 11,000 each year by the 2050s, if there's without the adaptation and the mitigation efforts. So that's the sort of the risk. And there are estimates that heat-related mortality in England costs 6.8 billion annually, and that's going to increase obviously over the years. So it's bigger effects, economic, environmental, people. It's having big effects in the UK. So let's think a little bit more about what can we do about it. We're going to talk in later slides about the resources that are available, but this one really just is thinking about the two main areas: mitigation and preparedness. So we want to reduce our carbon emissions. A lot of us are already doing things that we can, and it's recognising that there's lots of small steps that we can make. We can protect our environment, we can improve our green spaces, encouraging more natural carbon sinks. We can look after ourselves, looking after our physical health, our mental health, and encouraging others to live well, so we are reducing that pressure on the NHS. The NHS has a huge carbon footprint, and a lot of that is from medicines and obviously healthcare, and a lot of things are unavoidable, but some things we can influence ourselves. And we can ask questions and try and find out what is the best way forward, whether it's a small question or a big ask. So that's the mitigation, the reducing our impacts. But also the other one is be climate ready, preparedness. So we can identify those climate risks. We can get prepared, get ready for, know where to find information about all of those different effects. It's the extreme heat and the extreme cold. We've got better, I think, at preparing for cold and having warm spaces, but in the future we are going to have to think more about cold spaces in those heat waves as well. I'm sure Amanda will talk more about the preparedness later on, but it's about having a plan, learning from each event and reviewing that plan and supporting each other and building our resilience. So we can make our choices as individuals in our own homes, in our own lives. We can make choices as organisations, and then we can also collectively in our whole communities. And I'll come back to the idea of communities and neighbourhoods in a moment. So What's the NHS doing? The NHS has set net zero. So in 2020, they set the NHS net zero targets. I'm not going to read them out. I'm sure you can read them yourselves, but they've set an ambitious target, and it was the first health service in the world to set these sorts of targets. The good news is that the NHS is on track to meet these targets. There was a 5 years of Greener NHS report last year was released, and it shows that direct emissions are down 68% since the 1990 benchmark. And in just the last 5 years, it's reduced by 14%. So really good news that it's all going in the right direction. And more recently, the 10-year plan has got 3 sort of clear areas that they're focusing on. They might not initially come across as being sort of environmental, but they are indirectly. So the 10-year plan identifies hospital community. Sorry, I'm talking quickly. Hospital to community. So moving treatment from hospitals out into communities, which obviously then links in with voluntary sector organisations as well. Second one is analog to digital. So using our digital tools, and that's where, again, voluntary sector organisations can support individuals to access services digitally, which will reduce the carbon footprint of some treatments. And the third one is treatment to prevention. So stating the obvious, it's much better to prevent treatment in the first place than us all ending up in hospitals. So all of those have that focus to contribute towards the net zero. And in our local NHS, so there's several green plans. There's one at CPFT. I'll try not to use the acronyms. Cornwall Partnership Foundation Trust. So that's the sort of community-based hospitals. They have got a green plan. The Royal Cornwall Hospital Trust, so Trelisk for other words, has got a green plan. And then the ICB, the Integrated Care Board, has got a green plan. So the Integrated Care Board of Cornwall and Devon are merging. They're coming together, and they have, both Devon and Cornwall have agreed the green plan from 2025 to 2030. And there's lots of our team, our climate resilience team, has written in as part of the delivery plan for that. And as part of this, you would have heard about neighbourhood health and integrated neighbourhood teams. So there are certain focus areas for that. And that's where not just health, but other organisations, including voluntary sector, are coming together in neighbourhoods. So the neighbourhoods will vary in size and they will look differently in different places, but they have kind of overarching aims as well. So one is proactive frailty, another is end-of-life care, and the other is discharge to assess. So all of these things are helping people to live better, live longer better, so keeping themselves well and accessing services that will keep them well and in their community. End-of-life care. End-of-life care has a huge impact on NHS resources. A lot. I can't remember the statistic. There's a lot of our medication is towards the end of our lives, so it's managing that as well. And discharge to assess means that people don't have to wait in hospital for an assessment. They can be discharged at home, supported in their own home, and be assessed at home and come back to hospital when they need to. So all of these things that the integrated neighbourhood teams are focusing on reduces the demand on secondary care, and we know that that's expensive financially, but also expensive environmentally, with a high carbon footprint and a high impact. So keeping people healthy and well in their community reduces the environmental impact, reduces the carbon footprint, but ultimately as well, it's great for people. We all want to stay healthy and well in our homes. We don't want to end up in hospital if we can help it. So all win-win situations, really. And then thinking about primary care. So I mentioned we are climate resilience team. I could talk all day about what we do. It's very varied, but in a nutshell, we've got 15 action areas that we focus on. And primary care now isn't just GP practices. It includes optometry, dentistry, pharmacy, community hubs, as well as the GP practices that we're supporting. So there's loads of different action areas, 15. They include things like declaring an emergency, looking at green banking, looking at energy, looking at waste and recycling, active travel, green spaces, I'll share our website with you later on, and that provides a really good resource for people to go and look at. It's aimed at primary care, but obviously a lot of the resources and a lot of the information is relevant to any organisation. So it's really looking at the bigger picture and then zooming in on one of those action areas and working through it with our support and with the resources available. So that's primary care. And then very similarly in the voluntary sector, working with BSF, this came out of the Climate and Environment Alliance last year, the Green Footsteps Guide. And it's got 13 chapters, lots of overlap. As you can see, energy, buildings, looking at food, for example, and audits as well. It's a massive document, and it is designed for voluntary sector organisations. But really, again, it's very transferable. You can dip in and just focus on one of those chapters at a time. And very soon there will be an downloadable, editable progress tracker, a big spreadsheet that can be edited by organisations so that they can plan and track their progress. And I think it's worth noting before I hand over to Amanda that there are lots of positive effects of taking climate action. And their physical benefits have been recognised for a long time. If you're going out doing beach cleans, if you are in the garden or in a garden building green space, obviously you are using your physical body, and that's improving your physical health. But it's now recognised that there are direct mental health benefits as well, and there's new studies coming out that prove our mental health is improved. So, for example, studies show that home retrofit programs and, for example, the Clean Air Zone in London, the ULEZ, have led to improved mental health. So that it's really positive that there are so many positive impacts of climate action on us as individuals as well as on the environment. So one of the chapters in the Green Footsteps Guide is on resilience, which leads us nicely onto Manda's section. Over to you, Manda.
Brilliant. Thanks, Annette. That was a really, really brilliant overview of some of the risks we're facing, all the things that we can do about it, why it's really good for us and the plan to take that action. And I'm just going to talk very quickly now about the other thing that the other side of the threat really that Annette mentioned, which is the adaptation or the preparedness bit. So it's figuring out what we can do about some of the things that are already baked into the system. And of course, that's really important for the VCSE because we do so much to support our communities and particularly the most vulnerable members of our community. So we need to know what those threats are so that we can keep going when things get very, very difficult. Our communities will need us even more, not less, when we are experiencing the sorts of extreme weather events that Annette's mentioned, such as in Goretti. I also remember, as Annette pointed out, driving down the A30 in 2022 and watching a whole bank of undergrowth burst into flames. And it was a really terrifying moment. I'd never seen that happen before. And seeing something alive burst into flames is really distressing. So we know in that year there were something like 3,000 excess deaths just in the UK from heat-related illness, and across Europe about 60,000. And Annette's already pointed out that between those years of 2024, we were seeing a lot of deaths, and that's what we're expecting now. So it has a real impact on ourselves at household level, at community level, and at what across our VCSE, because all of those impacts on an individual's health will also impact us as organisations whilst we're trying to support somebody else. Next slide, Annette, please. Thank you. So one of the things I did last year was just look very, very quickly across the VCSE, not to say, are you working on your recycling or your energy supply or your active travel, but really to see where we were in relation to our sense of resilience. And I think the three things that came out of that research, I talked to a lot of. It's going backwards and forwards, Annette.
Sorry.
Are you?
I'm trying to make sure you. Can you see that?
Yeah. Yeah, that's okay. All good. Yeah, that's perfect. No problem. I just wanted to do something a little moment all by itself. So talking to VCSE organisations across three areas: our people, which is our staff volunteers, and our communities, our processes, which is our governance and policies and our training as organisations, and our places, which is the places, the buildings and the places we work, the systems we use like IT and comms, and our partners, because we all work in a very interconnected way across the sector. How ready are we? And the answer came back very simply: we're not ready. We don't feel ready for these extreme weather events. The second point was we're not sure what to do to make ourselves more ready. And the third point, and these were very clear category responses, is that we really want to learn what to do, how to do it, and who we can do it with. So that was very, very positive. It gave us a very clear direction of travel. There was a sense that we felt there was something else that we needed to ensure that our organisations and our systems and the services that we were delivering could carry on, even in the face of these extreme weather events. We can't just pack up and go home. We need to look after our organisations, our staff and our volunteers and our trustees. We need to know what we're doing, and we need to know how we can continue to support those most vulnerable communities. So we came up with a whole bunch of things. So next slide now, thanks Annette. And talking to, thank you, and if you, that's the one. This is a tiny compression of loads of ideas that came up talking to different organisations and different colleagues across the VCSE to say, actually, there's a ton of stuff based again on that notion of there is action we can take here. Just like Annette was pointing out, it's really important. This is not a moment to sit back, fold your arms and say, oh, well, it's all too awful. That's not a reasonable response to take in the face of a crisis. It's also not good for us as human beings because we can end up feeling paralysed. The best possible antidote to the overwhelm that we can feel with any of this is taking action. And these are some of the things that people were talking about as individuals and homes and households, as organisations and as communities. So we're talking now about seasonal training exercises, going through what happens if type scenarios with staff, volunteers, trustees and directors to make sure everybody is ready for anything. Making sure we're really looking after our volunteers. Very often our volunteers can be a bit older. They may well have their own vulnerabilities. We can't be sending out people who are struggling in the heat as a volunteer to go and support somebody else who is struggling in the heat. Likewise, in stormy weather or very icy weather, we need to make sure our volunteers know how to look after themselves and how to respond appropriately in a situation where we're asking them to help other people. How do we make sure our volunteers are safe enough to help others? We talked about business continuity plans, which are really just organisational continuity plans. What do we do when things get really tricky and sticky? How do we keep going? Where do we keep our information? How do we communicate? How do we know what activities to stand up and stand down? How do we communicate with each other across the sector? How do we communicate with statutory services and blue lights? All of that can be part of our continuity planning. Making sure we understand how our communications work. That's all changing. I think quite a few of us will have received the emergency message that we got from Goretti, but we didn't all receive it at the same time. We didn't even receive it on the same day. And some of us got it on our work phones and some of us got it on our home phones or personal phones. So those communication systems aren't necessarily reliable. So how do we build something locally to make sure that everybody knows what's going on, what they can do, what they shouldn't try, and what support there is available? We've talked about grab bags. Grab bags is essentially the thing you have by the door that you can pick up or in the car that will give you the basics of what you need in an emergency. Really, really simple things, and I'll come on to that in a second. But we know we've got at least one colleague inside Volunteer Cornwall who has impressed me enormously by not only having a grab bag in his car, but he's got a seasonal grab bag, which is going above and beyond, I think. So he has things that can work in extreme heat and things that can work in extreme cold. So it's just a very simple self-help action that everybody can do without having to buy expensive kit. I often refer to it as the same thing as, if you're pregnant, you don't wait until your waters break before you figure out what you need to take in your bag to the hospital. You have a bag ready by the door. Talking about organisation and sector-wide ability to come together and say, right, this is happening. Maybe the weather alert is going from yellow to amber. This is where we stand up. This is where we understand what the situation is. And this is where we decide what action we're going to take. So we're having conversations along those lines at the moment. Community emergency plans are written by local town and parish councils. Do we know what they are? Are we integrating the work that our amazing community hubs are doing into those emergency plans? How can we improve those? collaborations, making sure we know what we've got in our communities. If we do need to use things like chainsaws and generators, who's got them, who's got licenses and expertise, who knows where the weak points in our community chains are and where the strengths are, making sure that we're working really well with the Community Flood Forum. They have incredible training for volunteers. They know where the flood risk is likely. They can secure funding for things like personal protective equipment. An incredible resource we've got inside Cornwall. Are we working with it optimally? As already mentioned, the importance of having cool spaces as well as warm spaces. We're very good at the warm spaces in Cornwall. We might now need cool spaces across our community infrastructure. And simply understanding how we can improve our skills base, knowing what a heat wave can do in terms of heat stroke or heat exhaustion, who do you call, what signs to look for, how can you make sure the right support is in place, and of course supporting our fabulous community hub network with the community emergency hub boxes, which if we'd been able to have a crystal ball, we'd have got into place before Goretti. They're now in place post Goretti, but Goretti has focused the mind extraordinarily. So next slide, please, there, Annette. Thank you very much. So the community emergency hub boxes are a very simple project that we're working on with VC, with the Local Resilience Forum. It's worth having a little look at their website, dcisprepare.gov.uk, and they talk about what community emergency hubs are. And a community emergency hub is essentially a community hub that is stepping up to support with knobs on what is happening in their community during an emergency. And we are helping them doing this by figuring out what their strengths are and how we can support them with some very simple kit in a box. So the next slide there, please, Annette. Thank you very much. The box is a box. It's a plastic crate. And there's some very, very simple stuff in the plastic crate. Information about what to do in a power cut, how you can prepare beforehand, how you can get onto the priority services register, which means you get an alert if a power cut is threatened, what you can do during and afterwards. First aid kit, first aid manual, crisis packs from the National Grid that might have some very simple kit like a flask or a hand warmer, or extra socks or a hat or gloves. Wind-up torches, information on the Flood Forum, a couple of whistles, incredibly useful in the dark and the cold to make if you're working with your community to support people in the moment of crisis. Wind-up radio. One of the things that came out of Goretti was the fact that people felt they didn't know what was happening. They couldn't communicate with people when the power went down. So this is a very simple radio with a tiny solar panel on it. It can actually charge a mobile phone. So you might not have a router and Wi-Fi, but you might have phone signal if you've got a hill nearby that you can get to the top of. If you can charge your phone, you might be able to find out what's going or communicate emergency services. So very, very simple kit. We're also working with Community Energy Plus to make sure there will be small, very simple cardboard thermometers that we can start distributing to people's homes. We've had these before that tell people when their homes are getting too cold. We haven't really got very many available that tell people when their home's getting too hot. And we know that people who are very young or might be elderly or might have a pre-existing condition might not necessarily know that they are overheating. And that can move from a state of discomfort to a medical emergency very, very quickly. So the more we can inform ourselves as community members and as the VCSE, what that looks like, the better we can sort of get ahead of the game and make sure we stop the problem becoming a crisis. Next slide there, Annette, thank you. And inside the box is something that the Local Resilience Forum, which is simply a partnership of the council and the police and the NHS and emergency services and the VCSE increasingly. LRFs are present across the UK. They sort of operate in slightly different ways, but they are there to do what it says in the tin, support a sense of local resilience during a crisis. And in this booklet, they have what delivering emergency support might look like if you are a community hub, things that you can and could do, things that it'd be a really good idea not to do. So, for example, do move information around and make sure people are connected. Don't necessarily give information to the press. So very simple. This would be great. Try and avoid doing this. And these are 7 roles that have been developed from various community organisations across the UK and elsewhere, actually, as to these are probably the most useful roles. They're called volunteer roles, but it may well be if you run a community hub and you've got a dozen staff, you can give each of your staff one of these roles, or the volunteers that you're working with. Essentially, it's a way of how do we reconfigure the capacity and the skills that we've got? What are the most important things we should be concentrating on? So these have turned out to be the most useful roles that people can take on. It might be for an hour, it might be for half an hour, it might be for 24 hours, it might be until the crisis has passed, or it might be until the blue lights arrive. But we know we have the skills, it's just finding the best possible way of deploying them. So the next slide there, please, Annette. Thank you. And we also make sure that as well as the box, and there are now, this is one of the boxes that Catherine was delivering this morning to Community Hub in Launceston. There are over 30 community hubs now across Cornwall that have got these boxes, but they've also got information on some of the things we've been talking about today, information about how they can figure out whether there is a bank of volunteers that have been trained by the Cornwall Community Flood Forum nearby and what they can do, information on health alerts and how they can get access to that, information on what a continuity plan might look like, information on how the National Grid can help them as well, actually, and what the community emergency plan process looks like, which is a function of the council, so that's a statutory service, but the number of community hubs who weren't connected with town and parish councils and vice versa is something that we can put right really, really quickly just by encouraging people to have a conversation to say, there is a community emergency plan process happening here in your town and parish council. If you're a community hub, especially if you're a community hub that's taking on this emergency hub role, go and talk to your town and parish council and make sure they know what you're doing and see what collaborations can come out of this. It could save lives, is basically what it comes down to. So next slide, thanks, Annette. And I think one of the things that we can think about quite quickly for all of us, again, working across those dimensions, is how are we ready at home? I want to make sure that I look after me and mine if there's a crisis, so that if the blue lights, the emergency services can't get to me or aren't necessary to come to me because I can look after me and mine optimally myself, I want to do that. So the grab bag is really the home household version of the emergency box. We can have community emergency hub boxes inside of community hubs. We could also have these inside every organisation that's got buildings, VCSE organisation across Cornwall, to make sure we've got some means of communicating, of looking after ourselves, making sure that we've got some sort of capacity and skills and training and awareness and readiness. And it turns out that the zombie apocalypse grab bag, which the state of British Columbia developed as a means of engaging its staff, is exactly the same as any ordinary grab bag, apart from the fact it includes a helmet to stop zombies eating your brain. So that's always good to know. You probably don't need a helmet to stop zombies eating your brain, but you really could do with all the other things that are in that zombie apocalypse grab bag. You know, like some basic medications, a wind-up torch, notepad, batteries, a bit of cash. Because of course, if the power goes out across an area, the power goes out. So that's no comms, no cash, no access to any communication to find out if the loved ones are okay, could be no food. And of course, there are a number of community organisations now and community hubs that are saying one of the things we learned from Goretti is we need to know who's got a change on a generator, very possibly, but who's got an SUV, 4x4 vehicle, who has a camping stove, who might have a tent, who might have flashlights. That sort of community mapping and understanding is incredibly valuable. You might, as I say, need it for a short period of time only, but it could be critical when you do. So just get a grab bag. I didn't have one last year when the storms were happening. Storm Bram, if you remember that, that happened around about, that hit sort of the Saltash Plymouth area. And I thought, oh, I must get a grab bag. Got to Goretti, still didn't have a grab bag. Have I got a grab bag now? I absolutely do. So the best time of having a grab bag was before the last storm. The second best time is today, if you haven't got it. And mine lives in my car. And I just feel better that I know I've got some basic kit that I had in my household already. But that's no good if it's dark and it's flooded. You need it all in one place. So get a grab bag, I would say, everybody. Next slide, please, Annette. There is lots of further information that we can all find, and we are working on this. This is exactly the conversations I'm having now with VCSE colleagues. Do we know what's available? Can we join our dots? Can we figure out what might be most useful for Cornwall and all of those particular areas in Cornwall that have got very different makeups in terms of rural or urban or different or very close to the sea or in the middle of the moor or hilly or flat. So we can find a way of making sure that the right places have got the right information. You can find more on that DCR's prepare.co.uk, sorry, from the Local Resilience Forum. Also the Government Prepare website. I think that's a bit stark, but it does have some really useful information on there. Likewise, the Voluntary Sector Forum has a map on its website with the community hubs that Volunteer Cornwall supports, and you can find out where your nearest community hub is. And the Local Resilience Forum is figuring out which of those is taking on that community emergency hub function, which will be great. And of course, the Cornwall Community Flood Forum talking about which areas have got a flood group, which areas have had training, which areas have got some capacity and resilience. Maybe it's Red Cross training, first aid training, but they know how to cope with flooding. Little things like, I always think of sandbags when I think of flooding. It turns out they're not a great idea because they can hold infection if you've got sewage in the water. And they have lots of different ideas as to how you can protect your home from flooding. So there's an extraordinary amount of information available to us. We just need to make sure that everybody's got access to it and knows where to go and get it when they need it. Our next slide, I think, Annette, now.
Yeah.
Brilliant. So that's us, that's me and Annette saying there's a ton of stuff happening. A lot of this is about joining the dots and figuring out how we can optimize our ability to be really resilient and imaginative, which we know we can be, but it's which tools and which capacities, which skills and connections can help us do that as well as we possibly can. We can definitely reduce the impact of climate breakdown. It's looking unlikely we can stop it completely. So at the same time as making sure we're not contributing to the problem, it's making sure we're geared up for its impacts in terms of our preparedness and resilience. And I think that we are already doing an incredible job across both of those issues in Cornwall. It's figuring out how we continually learn and build on those skills. So I don't know if anybody's got any questions, but I think those are my slides done. Annette and I are here for any thought-provoking ideas that people might have.
Thanks, Manda. Yeah, I was just going to sort of take it back to the start in terms of the title of of this session, why climate resilience matters for neighbourhood health. And I think just to sum up that we, especially in times of extreme events, we depend on our neighbourhoods, our immediate, literally our neighbours, so much more so than thinking of the bigger picture, and that's what we need to come back to and being ready for and adapting to. And I think linking in with the existing services, and there's a lot of talk about neighbourhood health and neighbourhood teams, and I think that's another connection that we're still building on, because we as a team are representatives, and there are lots of voluntary sector representatives joining the neighbourhood teams, but I think we're still building on the understanding of what's available where and who's got those emergency boxes and who knows where to go. And so we're still learning, we're still building, but the blocks are there and it is all coming together. So yes, I'll hand over to Matthew if you wanted to sort of manage any questions, or how are we doing?
Thank you. Yeah, thank you, Ben.
Hiya. Thank you, Manda. Thank you, Annette. I have to confess I did disappear for about 10 minutes. I'm really sorry. I took a phone call. So if it happens that the question I'm about to ask corresponds to something you said, I'm very sorry. I was listening to the rest of the 32 minutes I was there. Neighbourhood health, population health, that kind of intrinsic link. I mean, what we're doing is obviously, and part of Matthew's organisation and team are very involved in this as well. But the building blocks of good health, of health creation, of population health management. I am still challenged very often at neighbourhood level in some of the steering groups that I sit across around what's climate got to do with population health, and how do we play a part in this? So I mean, I suppose I'd just like some bite-sized bits that, as a layman compared to you both, how do I respond to those questions? What can we do as a neighbourhood team or as a primary care network?
Well, the first thing I would say is that one of the things that Annette and I and the team talk about is the most vulnerable members of our community are always the ones that hit first and worst.
Mm-hmm.
So we can't really take ourselves seriously if in actual fact we're not making sure that people who are already made vulnerable by structural issues like poor housing or poor access to food or poor access to transport or comms, we know that they are already being hit by.
Is it all right if you pop the thank you? Your
yes, beg your pardon. Sorry. I don't know if you got that, Ben, but it's essentially the most vulnerable members of our community are hit first and worst. So everything we can do to shore that up. So it's not asking people to reduce their carbon impact if they're struggling. The people that we ask to reduce their carbon impact are those people who are spending too much of our climate, if you see what I mean.
I do.
Our response to people who are in our communities is how do we help you feel safe?
Mm.
And we can very often help people feel safe by all the things that Annette was talking about as well.
Yeah. Sorry to I will stop talking in just a second, but I feel like there is a responsibility on us as a sector, especially, you know, in the conversations we have about shifting left, capturing community voice. We are that bridge and that link. So I take your point entirely, Amanda. Thank you.
I would just add as well, Ben, that it's really hard to separate planetary health and human health, because everything that happens with the planet's health has an effect on us and our health, and vice versa. So, you know, the more medication that we take as a population has a direct impact on the. So it's seeing it as a both ways, rather than the climate happening away from us and we're in our bubble being people. It doesn't work like that. So I think that's the. And it is an ongoing. I mean, we've been, Amanda and I and the others have been working in this for a long time. It feels like another ask when there's so much pressure on health and the systems. It's another ask, and I think we've tried to frame it in a way that it's not another ask. It's kind of what you're already doing, because what our priorities are making sure people are safe and well and healthy, and that's the ultimate. You know, we all want that. And yes, there are emergencies where we will kind of have to respond to those emergencies, but ultimately we all want to be healthy and well, and that the planet is so closely linked to us, and this is where programs where we're encouraging nature connectedness is so important, so that people recognise that. And this is for all the staff working in health and care and everything, as much as, you know, all of us here. Everybody needs to be connected to nature to recognise that value and understand that the little things we do have a difference. And I think empowering people and making those links, if we keep people at home and healthy and well, and they're not travelling to hospital, it's just simple things like that, then that's a journey that we've cut down. It's just little things. It doesn't have to be. It is overwhelming. I mean, I've just given that presentation and I feel overwhelmed every time, because it is just, yeah, it's a lot going on. But I think it is breaking it down to and individual jobs, individual roles. What can people do in their own roles, rather than thinking about the whole system all at once?
Yeah, thank you both.
Amy.
Okay. As I said, we're interested in creating a climate resilience funding pot. And I think it would just be really helpful for me just to hear from people who work in the sector are there any particular gaps in funding that you've identified? This is a huge topic, but, you know, in terms of small grants, is there any particular kind of priorities that you think a small grant scheme in Cornwall should focus on to address climate resilience?
I think that's
both shout at this.
Yes. I think it's a conversation we may need to have not in the next 3 minutes, but I'm very excited that you're here and you're asking that question, and I think both Amanda and I would be very keen, and Catherine's nodding as well. So, for example, we get loads and loads of organisations, GP surgeries, community hubs. Everybody wants to improve their green space, but have they got money? They don't need loads of money, they don't need billions, they just need to have sometimes 1,000, 2,000 to get started, and then volunteers can do the rest, or the organisation can get So I think lots of little small pots, and it being quite a simple hoop to jump through is my quick answer. But yes, please, Amy, let's get together and talk some more about it.
Thank you, Amy. And Tim.
Yeah, thank you. I respond to Amy as well in this. A couple of points I wanted to add in, and partly in response to Ben's question. One, we need to recognise a key bit of the resilience conversation is about helping people be stronger in able to cope with the scale of the impacts and repeated impacts. You know, we focused on Goretti and keep talking about Goretti, but actually there were 3 major storms that hit Cornwall in a fairly limited period. And so that building resilience is about helping people cope with repeated impacts. And so if they get knocked down, building back, they've got to build back with the ability to respond to the next hit. And that, I think, increasingly is going to be a challenge for all of us. I think with my energy hat on, and particularly dealing with fuel poverty, I'd say the real critical thing that we've hit repeatedly in the past few years is around the interaction between physical health and mental health. And there's loads of people, you know, as Amanda said, living in a cold, damp home. Their mental health is just deteriorating and they're not coping. And that builds up again in a sort of pattern of behaviours. And so that sort of community neighbourhood health has got to include an element of the whole befriending, coming alongside people, picking them up. The whole sort of impacts we've had of isolation, I think, has been sort of slightly sidelined in some of these conversations that we've got. A lot of people who, you know, because of sort of fractured families and they're living down here and not really in immediate contact with close family, we've seen it quite a bit in terms of people with long-term limiting health conditions, and they're aging and their family is up country, and so the sort of care and support for them is falling apart. So there's, I think, some of that. Amy, I think we're already having a sort of direct conversation with you and Tamas about supporting some of the sort of community assets, but I think there are some bits we need to recognise that we've got a lot of community buildings that over the years, you know, small groups of volunteers have kept them going on very limited budgets, but they're struggling. And often the committees are getting a bit older, and we need a sort of real input of new people with some fresh enthusiasm, because it's the sort of grant piece is about people thinking, oh, have I got the ability to put another grant in? And the sort of the competitive grant environment we create doesn't help. So if we can find ways of making it easier, that would be very helpful.
Thank you. I don't know whether Amy or Annette want to come in on that, actually. I'm conscious that we have finished, so this is an extra. So if we can keep these pithy, that would be amazing.
Just to say, my role at the Community Foundation is focusing on getting donors to give money to us rather than on deciding where the money goes. So this is really good evidence gathering for me. I'll have a chat to Tamas to kind of find out a little bit more about the conversations he's had with you in the past, but I'm sure we'd like to pick it up more generally. But I'm just trying to convince some donors to give us some money. So that's why this is really useful.
Thank you very much.
A small drop in there, Amy, is that I spoke to one of the community hubs who said that they were trying to find ways of making their community hub building more resilient in terms of power and energy, so they could provide support to lots of community members in the time of a crisis, and they couldn't get the money, even though it was clearly a really, really good idea and was really good value for money, because they were going to be supporting lots and lots of people. So something to support our community hubs, and Ben is heavily involved in that as well, would be
Thank you, Manda. Annette, did you want to just any last thoughts? And if not, thank you so much, Annette and Manda, for sharing the content today. A little bit of information. We're going to be going back out to our members and asking what the next few subjects of our Lunch and Learns are going to be around, specifically within the integrated neighbourhood team space. So do please watch out for our newsletter and comms, and unfortunately a survey. But for us to be able to have that interaction will be really, really useful. Thank you so much, and enjoy the rest of everyone's afternoon.